What does it take to become an industry leader? At Mada, we understand that the hard truth with every patient you see is that they hate needles. That's why the MadaJet needle-free injection system is the only real solution that can offset the apprehension associated with a needle.
Well, with the needle, you feel that prick. You feel it, going in for that second. This year, I didn't feel nothing.
In 1969, the MadaJet was first introduced to the dental and medical market. Since Mada had the distinct advantage of observing the weakness and mechanical failures of other jet-like products, it resulted in an advanced and unique system that is second to none. The basic concept was derived from a portion of the fuel jet injection system commonly used in diesel engines. Fuel is forced under pressure through an orifice, thus producing a fine jet stream, and then a resulting mist, which is significantly more efficient. The MadaJet fits in your hand like a syringe. With a maximum loading of up to 4.0 cc's, the MadaJet permits approximately 38 injections. The MadaJet offers a consistent volume of 0.1 cc per injection intradermally. All common sterilization methods, except dry heat, can be utilized. The operation of the MadaJet is as easy as can be. Since it's a closed system and needle-free, fluid can only come out of the MadaJet, and nothing can enter the head assembly or fill chamber. Operation is begun by cocking the lever. This raises the piston from its resting place in the head assembly to an exact distance and locks into place. The local anesthetics in the fill chamber run down into the head assembly in front of the distal end of the piston. Since gravity is a key element, always cock the MadaJet nose down. When the release button is pressed, it frees the piston to move downward and compresses the fluid, driving it at 1,800 pounds per square inch through the jet washer orifice, forming a needle of solution. Absorption of the anesthetic is fast and greater because the fluid does not have a chance to pool as it does in a needle injection. The single 1/10 cc of anesthetics injected generally lasts 30 minutes. Also note the fine wheel made with the MadaJet, which is the anatomical site for deep needle insertion when required. However, the most interesting fact about the MadaJet was the onset of anesthesia was virtually instantaneous. After you briefly explain the differences between the MadaJet and a needle to your patient, you'll see that a new peace of mind has been established. Begin with the correct loading procedures already mentioned, and then place the MadaJet with the sheath gently and perpendicular against the specific area to be injected, and press the release button. The MadaJet not only functions as an injection device to inject skin tissue, but is the only jet injector that allows physicians to inject through all body orifices for internal tissue infiltration. The MadaJet injects a needle of solution that disperses in a spray form below the epithelium. This produces an immediate and greater tissue response versus the needle and syringe technique. By using selected length of the extended tips, you'll experience greater versatility when injecting into the ear, nose, and throat areas with minimal patient discomfort. The MadaJet is excellent for incision and drainage, biopsies, pre-injections for bursal and tendon injections, for anesthetizing skin tissue for suturing lacerations, and incisions. By using the MadaJet with local anesthetics for rhinoplasty, hair transplants, small skin grafts, and some reconstructive procedures, great patient response will be observed. The MadaJet is ideal in the treatment of most dermatological conditions by using anesthetics or in combination with steroids. Excellent for injections in the vagina, cervix, paracervical tissues, or vulva. It is also very effective when injecting the perineal area for episiotomies. Plus, when injected into the scrotal sac, can provide sufficient anesthesia for vasectomies. Colon and rectal surgery extended tips fit easily through standard scopes, treating anal fistulas, hemorrhoids, biopsies, and removal of anal warts. As you can see, the MadaJet is a truly unique injection device that will provide the physician and patient a method of reducing fear and psychological trauma associated with the traditional needle syringe injections. and at the same time, allowing smaller doses of anesthetics to be used. It is not important whether the MadaJet hurts more or less than the needle. The fact is, there is no needle. Patients hate needles.